has murdered 12 people and wounded several others. His actions have had a profound and everlasting effect on the families of the victims. I don't know why he did what he did, and I'll never be able to ask him why. Aaron is now in a place where he can no longer do harm to anyone, and for that I am glad. To the families of the victims, I am so very sorry that this has happened. My heart is broken.
Kathleen Alexis, the mother of Navy Yard gunman Aaron Alexis, reading a statement earlier this week from her apartment in Brooklyn, the shaking in her voice. She didn't want to go on camera, the uncomfortableness that she has in speaking to all of those affected by her son's actions. When we see situations like this, we always, the next day, look at what happens now. Where are we now as a country after another one of these massacres, another one of these mass shootings? And it also draws attention to mental health and mental wellness. We are glad to have with us Marcia Dries. She is Director of Cemetery Wellness with Harbor here in Toledo. Next to her, Diane Winkler, psychiatric nurse, also with Harbor. Ladies, thank you so much for taking some time. This is not an easy conversation, but it is necessary when we have situations like this. Diane, let me start with you. And we don't want to so much get into what happened specifically in Washington, but we heard earlier this week and after the fact, unfortunately, that there were red flags. Is that usually the course of what we see happen when tragic situations stem from mental wellness issues?
Right. I think it's really typical to be able to look backwards and use some hindsight and say, yes, this was the red flag that we missed. And usually agencies like ours at Harbor, we have critical incident debriefings, and I would assume that that's going to be going on, and we're going to find out a lot more information as time goes by. So I would really caution people to make their final judgments a little bit later when we have more information. It's easy to point the finger right away. I think that, you know, there were many missed opportunities for this poor young man, but that happens in our field. Patients frequently don't want to be on medication, and there's also the macho feeling when you're in the service. I have a son who's a chaplain's assistant, so that involves a lot of counseling. And he just deployed to Afghanistan, and he said over there it's very frequent for people to want to just swallow it down. It's very unmanly to go and ask for help, and when you're in the service, that's the height of manliness to most people. They see you as that, and you're admitting faults.
You mentioned, and I'm paraphrasing, you said kind of check your judgments at the door as far as wait till all the information comes out. Check our judgments on what? On criticizing the people that did miss those red flags, and why did this young man still have the clearance, and people are talking about why wasn't he on medication, and why wasn't he in the hospital, and why was he still out. And it's hard for us to say because we don't know all the issues. I think that's why it's looked upon as a healthy thing to be mentally well. Right. To go out and have conversations. And Diane, let's bring you, Marcia, let's bring you into this conversation. When you talk about the macho attitude, and let's break away from the military. Obviously, when we talk about situations like Aaron Alexis, when we talk about Major Nadal Hassan, who was a psychiatrist with the armed forces, you see this mentality that it's a veterans issue, it's a military issue, but it's not.
No, it's not.
These just are high-profile cases.
Right. These are the things we see, you know, in the media, and you know, there's a lot that's going on in the mental health arena to try and combat the stigma that goes along with mental illness, because oftentimes people don't want to address it, they don't want to know about it. There's still a fear, even all these years.
Or they don't know?
Yeah.
I mean, is that a safe assessment?
Yeah, I think there's a lot of there's a lack of awareness, you know, of what even a mental health issue is. And if I see one, what do I do? I facilitate a program called Mental Health First Aid, and the main thrust of that program, which is nationwide, actually worldwide, is to help the layperson become aware of what constitutes mental illness and how would they intervene until professional help can assist, much like with first aid. So, you know, in this situation, in retrospect, as we walk away, one of the things we can do is try and have more people become aware of this topic.
But is it beyond just being, I guess, diagnosed depressed? I mean, is there like a fact sheet where you look and you say there's almost like a litmus test, if you will, to say, okay, you fall into this category of being someone who needs mental assistance or mental wellness checks?
Well, certainly, you know, in our field, in the mental health arena, you know, we assess for lethality, and we look at the profile of one who may be prone
Now,
toward
what does that
violence.
mean? You assess for lethality?
Well, we look at somebody's, you know, just as a standard course, as we evaluate someone coming in for services for any reason, we will ask if they have any history of suicidal ideation or homicidal ideation. We're checking if there's any evidence of psychosis.
Simple thoughts. They pass your mind, or
substance
this is something that somebody's really been thinking about?
Right, and you know, psychopathology, it's a vast topic, and so in this particular situation, I mean, we don't know exactly, you know, afterward we can do what's called a psychological autopsy and kind of look at the whole picture and the facts, and as Diane was saying, get a better handle on what may have been going on with this gentleman. You know, we can say maybe there were some red flags, again, in retrospect, and try and glean from that what we can. I mean, I think our universities are all doing really well now since some of those tragedies have happened. They've all heightened their security. They've got programs for faculty to detect it among their student body.
But these continue, and as we said, these are high-profile cases. I mean, you go back to Columbine. Obviously, we had Sandy Hook last year. Chuck Hagel, Secretary of Defense, earlier this week, coming out, and he used the word red flags. Let's play that for you at home.
There were a lot of red flags. Why they didn't get picked up, those are all legitimate questions that we're going to be dealing with.
So just coming forth, him right there saying, yes, there may have been things that we could have checked on. When you go back, and as we said, staying away from not only talking about the military arena, but when you look at an individual who is not accepting the fact that there are issues or their needs, whose job is it to, I guess, bring that individual forth?
Well, it depends on who he intersects with. You have to understand that someone who's psychotic feels that that's their reality, and that is reality. So they don't feel that they're sick. These are really things that are happening to them. So it's going to be up to the person that they're speaking with when they bring these delusions to the forefront. Like Marcia was saying, if they're schooled in some of the mental health issues, they can perhaps convince and use their rapport. It all depends on using rapport to getting the person to at least say, go to this clinic, just talk to this person, and then hopefully it'll snowball from there, and then you'll get the treatment aspect. But it's really important to know that these people, when they're that psychotic, really don't believe that they're ill. This is very true to them, and that's why they go off their medications a lot of times, and that's why we have a lot of medication non-compliance, because you need the meds, I don't. These things are really happening to me.
Okay. You look at the situation that we learned after the fact with Aaron Alexis. He had been to the VA clinic a number of times. They had diagnosed him. He was complaining of insomnia. They gave him medication. He didn't go to follow-up checkups. He didn't take his medication. So once again, maybe alluding to what you said, that arrogance, that feeling that I don't need help. Is that the major issue? Is that the major issue that somebody else needs to bring to people's attention, I guess?
Well, I think in that example, he was reporting physical symptoms, medical symptoms. He wasn't necessarily reporting, you know, mental health issues. So we as professionals have to ask the questions.
But later in the week, we also heard that he was hearing voices.
Yeah. So that there comes in the mental health issue. But statistically, when people go to their physician, they underreport the mental health and they will report the physical. So again, that's where training comes in, that people have to be able to detect that and connect the dots.
This is such a media question. Is it getting worse? Are we seeing more reporting, or are we seeing more occurrences?
You know, I think we have to think about what are the most prevalent mental illnesses in our country. And the top 5, you know, anxiety is number 1. And who among us hasn't had moments of anxiety?
Yeah.
You know, secondly are the mood disorders, depression, bipolar. Third would be substance abuse. And 4th, eating disorders. 5th is psychosis. That's 1% of the population. So we're not talking about a huge segment of the population. Nonetheless, we do need to obviously treat that segment of the population. So, you know, I guess from my corner of the world, I do a lot of crisis intervention and post-trauma work with employees who've had trauma in the workplace. I'd like to believe it's getting better, you know, that people are trying very hard to detect these problems before they become a major issue.
I wanted to bring out, Diane, you had an unbelievable connection to the Major Nadal Hassan story with a son there at Fort Hood when this happened, having the background in psychiatry and in your family and seeing this from a first-hand, a second-hand, and almost a third-hand perspective. As we go down the road and treatment needs to improve, is that your read?
Oh yes, treatment, you cannot stay stagnant in any field anyway, and treatment does need to improve, but it is improving by leaps and bounds. Our medication options are so vastly much better. They don't have the side effects that they did in the 70s and 80s, so we have a whole new group of medications, and there's a lot of medication right now that's available by injection that lasts a long time, so that if you have someone that only shows
You're not always
up,
popping pills.
right, well, and you're not depending on that person to be compliant. They come into the clinic, you see them get the shot, and you know they're good for 2 weeks.
What is your defense toward those who say we're over-medicated as a population already?
Well, I really don't, I can't address that specifically, but I could say in general that if you under-medicate and you have more and more episodes like this, how are you going to feel about that?
Yeah.
So, I mean, are you okay with increasing these incidents by decreasing the treatment and the medications?
Is Lucas County, is Northwest Ohio any different from any other section of the country as far as those issues, mental health issues that face everyday life?
No, I mean, I think we have, you know, certainly people who are affected. You know, again, 1 in 4 Americans in a given year may be exhibiting some form of mental illness.
Yeah.
Some of that may be a long-term condition, some of that may be a short-term. I think the key is to get proper treatment, including diagnosis, to know what the treatment should consist of. You know, sometimes medication's in order, sometimes it's not, but we have to know what we're dealing with, you know, in order to properly care for the individual. And it is tough because we're free agents, you know, we have choice in life, and so people aren't necessarily going to be committed, you know, to getting help unless they're at risk of hurting themselves or others.
Yeah.
So it can be very tough to motivate people to want to get the help, or even to see, as you said, that they even need it.
The other problem that we saw, you know, there were articles that came out with the Nadal Hassan story, and it said families of those who were killed in the attack may feel some sense of relief that the trial is finalized. You got the death penalty in this case. Some of the more than 60 witnesses and survivors who testified may have a cathartic release in being able to confront him with that. And then you're dealing with the impact aftermath of those who have viewed all of these cases. So we as a public who continue to see these scenarios play out and have to digest, thanks to us, the media members, of covering these stories, but it's played out again and again. And we've asked this question on this desk before: how do people deal with these types of stories that keep happening? Those types of stories here locally. We've had to deal with the deaths of children at the hands of who knows who. But how do we, I guess, deal with it?
Well, everybody has their own coping mechanisms. Sometimes it's talking with friends. It's certainly not keeping it within yourself. I don't consider that the most healthy choice, because you can magnify the importance of it that way. I think it helps you to deprogram yourself just with conversations with friends. There's also the religious aspect. You know, people turn to their religion for help and solace. And then there is also counseling if you feel strongly that you're getting some PTSD symptoms from all of this. But certainly for those people at Fort Hood, it gave them closure. And a lot of times what we see is that, you know, with some of the recent ones, we don't have closure yet. And that just prolongs the empty feeling and the anger.
And you bring up post-traumatic stress disorder. Obviously, that is something that is linked to military members a lot, but it can be just the general public who is viewing violent episode after tragedy after tragedy. And that is something that actually people need to realize it could be affecting them.
Right, there's certainly a balance, and I think especially, I think of children, you know, after events like this, it's very important that we look at what's age appropriate. You know, children may not be appropriate to be viewing any of this, you know, on TV or hearing it on the radio, but parents need to take the lead in talking to them in a way that they can understand that mommy and daddy are keeping you safe and your school has these things in place to keep people from coming in, and to just talk, you know, openly at a level they can comprehend. Of course, as they get older, you can talk more about the severity of it. But I think for adults, you know, viewing things repeatedly is not healthy. It's good to be informed and to catch a segment, but to make yourself watch it over and over. I mean, I think about 9/11. Oh my gosh, how many times were we watching the same things over and over? And you got to wonder on what level.
And relived it again just 2 weeks ago.
Sure, so, and then so what does that do to our psyche? And if I already have an issue, it may aggravate that, or it may trigger me. So we have to be cognizant, you know, what are we putting into our path? Maybe it's not just the media, maybe it's, you know, the things that we're involved in, video games, you know, and we talk about that a lot, and how it can predispose us to violence.
If people out there, our viewers today, want to find out more about Harbor, they can go to your website, Harbor.org. Harbor.org. Ladies, thank you so much for spending some time with us. Stay with us when we come back here on the Roundtable, spending some time talking about a member of the community we lost this past week. We'll be right back.